Welcome to Your Surgery, helping you take control of your health and well-being. Due to ever-increasing demands on the NHS, general practices now employ a huge range of skilled professionals here to ensure you get the best treatment first time. We know that sometimes it can be a bit confusing understanding the role of all of the people that are working hard to help with your care. This video aims to explain the different roles of some of these. The second part of the video is all about how to get the most out of your 10-minute consultation with the GP and is based on feedback from GPs themselves. Should you have any further questions, please ask the receptionists. The first people you are likely to meet are the reception teams. We may ask you what the problem is when you come to make your appointment. This is to enable us to book you in to see the right person first time to deal with your problem. If you don't feel comfortable telling us, then that's fine too. We're here to help with any queries you may have and are your first port of call when you arrive at the surgery. As medical secretaries, we are the key in processing referrals to hospital teams and the letters that come in from them. Should you want to know how long you are likely to wait for your hospital appointment, it is useful to call the hospital consultant secretaries and we can help you to do this. As the practice manager, we are in charge of the day-to-day running of the practice. We welcome all feedback, both good and bad, and ensure this is passed on to relevant parties. We know we don't always get things right, and we respect an ethos of candour and honesty so that we can learn and improve. Many practices have a range of students. Some have medical students. We are training to become the doctors of tomorrow, and we will always be supervised. We sometimes will be sitting in with another member of the team, and sometimes we'll be seeing you on our own prior to your appointment with a GP. We may ask you about your background and ask to examine you. You always have the right to say no to us seeing you, and we are really grateful for you taking the time to speak with us. Nursing students are in the community on rotation. We will be supervised and are learning the role of practice nurses and will work alongside them. We are really grateful for allowing us to sit in with you, and everything you say is confidential. Later in our training, we will do our own wound assessments. As an HCA or healthcare assistant, we work alongside our nursing team and are key to the running of the practice. We help our nurses and doctors, and amongst other things, will perform dressing changes, blood pressure monitoring, ECGs, warfarin monitoring, and are experienced at taking blood tests. As practice nurses, we are here day to day to manage a wide range of chronic illness, including your annual asthma and COPD checks, wound checks and dressings, advice and give vaccinations. Minor illness clinicians. These are skilled nurses and paramedics and even some pharmacists. As minor illness clinicians, we see a range of acute medical conditions of people of all ages and support the duty doctor. We are often your first port of call here at the surgery if you're feeling poorly that day, and some of us do visits. We may also be able to help with contraception advice. Pharmacists. An increasing number of surgeries work closely with a pharmacist. These are highly qualified practitioners who have a huge amount of knowledge around your medication. They can suggest changes and monitor you for side effects. Also, don't forget many pharmacies in the country can now advise you and prescribe for many common minor illnesses, saving you time and avoiding the need to come to the GP. Advanced nurse practitioners are highly trained, experienced and specialist nurses and are trained to undertake assessments of patients, make diagnosis, request investigations and prescribe in a way normally reserved for a doctor. They often have completed an MSc in advanced clinical practice. They can prescribe and in some practices work in a very similar role to a GP and are key to help manage GP shortages. Other practices work closely with physician associates, physiotherapists, psychologists, smoking cessation advisors, community matrons, district nurses, social prescribers, and other allied health professionals, and the surgery may recommend seeing these in the first instance. GP registrars and trainees. The term trainee can be misleading. We have completed 5 years of medical school and have already worked in the hospital as junior doctors. We have now decided to specialise in primary care and spend 3 years on rotation in hospital and in the community, ready to be fully fledged independent GPs. We see patients with any condition on our own and can prescribe but have a GP in charge of our training. GP. Your GP is in charge of you and your family's overall care and liaises closely with all of the team already mentioned to coordinate this. Whilst our knowledge is broad, we often ask you to see our specialist team already described, as they have detailed knowledge of the most up-to-date medications and guidelines in these areas. We work closely with our hospital colleagues to ensure that if needed, you are referred to them, and we will follow your health over many years from birth until death and see complex patients. Behind the scenes, we also work with local organisations, other surgeries and commissioning groups, and represent you individually and as a population, championing further local improvements and services. As you can see, lots of people are here to help you. If you have any questions on who you will be seeing today, please ask our reception staff.